When we're looking for the single gene disorders, it's some of each. So much of the time, you make a diagnosis of single gene disorder and it doesn't necessarily affect the treatment, but there are some cases where it does. One of the classic examples in obesity is if you figure out that somebody is leptin deficient, and there are very, very few patients of patients who are obese, very, very few of them will be leptin deficient, but for the ones that are, then leptin replacement therapy has a dramatic impact, and it's something that wouldn't work at all in the rest of the population. But I think it's some of each, certainly. So there are definitely patients in whom we've made diagnoses who've been very relieved to finally figure out what has been causing their child to, grow the way they do or to be obese the way they are. Most of what I do in this realm is actually in the research setting. So the way that they would get to us, and most of our research is around very early onset obesity or short stature. And we collaborate with some other folks as well so that they could reach one of them. But essentially they would need to be in a place that's doing this sort of research. That being said, there are plenty of clinicians who treat short stature or treat severe obesity. And one of the things that I'm hoping is that there'll be a little bit of increased awareness to say that some of those patients are going to have single gene disorders. So I think we're still in somewhat early stages. Exome sequencing, which is the tool that is often used to make diagnoses where you don't have a good guess as to what's going on, that's becoming available, but there the interpretation can be challenging. I think it will change over the next few years where more and more clinicians will become comfortable with that. But for now, that is still a sort of specialist, kind of procedure. But that being said, if a clinician has a good idea as to what genes might be, so if you think somebody has Noonan syndrome, there are clinical labs that will test for Noonan syndrome. You can send the DNA off, and so that's actually, you don't have to live in Boston or somewhere, some similarly dense concentration of super specialists. Yeah, so pediatricians especially will be seeing more of a enrichment of people with single gene disorders because they tend to present earlier in life than just the garden variety forms of most diseases. So, for example, for obesity, if you look for MC4R mutations in adults, you have to look in the very most extreme people to find them. But if you look in very early onset patients, then you start to find more of these single gene forms. So for pediatricians, it's I think particularly important. Endocrinologists, I would say, no more so than any other specialty. Genetics really crosses all clinical specialties. The specialty that probably knows the most about this is actually oncology, because cancer is almost entirely, in some ways, a genetic disease. It's not the genes necessarily that you were born with often, but they're genetic changes in the cancer itself. So oncologists tend to be very aware of genetic changes.